Welcome to week 34. Your baby is now as big as a pineapple. Your baby's about 2.1 kilos, or 4.7 pounds, and almost 46 centimeters, or 18 inches, long. He's still moving lots, but the movement will feel different. Less kicking and more wriggling, because that kid is most definitely out of room. Your baby's hearing is fully developed now too, so get your lullaby on or let your partner read a book to the bump. You've probably heard moms complain about swelling, especially in the summer months, but extreme puffiness can be an indicator of preeclampsia. If you notice pronounced edema, a fancy phrase for excessive swelling, especially if it's accompanied by headache, blurriness, or flashing lights in your vision, hightail it to the hospital and have the doctor check your blood pressure and for protein in your urine. Preeclampsia will resolve after the baby is born. Make sure that you have breast pads on hand from here on out because your boobs have figured out their new job, feeding a baby, and may start to leak. The liquid you're noticing is colostrum, the nutrient-rich substance that precedes milk, and this pre-delivery leakage is nothing to worry about. Speaking of leaks, you may also notice more vaginal discharge. This is a result of increased blood flow to your pelvis, spurred on by the estrogen racing around your body, as well as the extra pressure of your growing baby. Panty liners are your friends. Pregnancy affects women differently in terms of sex drive. Some women notice an increase in desire, while others would rather walk over hot coals. In the third trimester, many women feel uncomfortable and tired, so sex is the last thing on their minds. Hormones also factor in, making some women hypersensitive, even to the point of vaginal discomfort. If you're not feeling it, that's okay. Your sex drive will probably show up again in a few months' time. But if there's even a glimmer of passion, try to nurture it. Embrace your gorgeous curves and enjoy some pre-baby intimacy with your partner. If you're considering co-sleeping or bed sharing with your baby, do your research on the pros and cons. Read up on the risk of sudden infant death syndrome and make sure that the sleep environment will be as safe as possible. If you're planning to breastfeed and haven't gotten a breast pump yet, it's time to think about it. Rent a medical-grade pump from your hospital or from a baby supply store or research models to buy. An electric pump is definitely faster than a manual pump, which you do by hand, but it's more expensive. Make sure to open your new pump, assemble it, and account for all the pieces it requires. The last thing you want to be dealing with is missing breast pump components, especially when you have rock-hard boobs engorged with milk and a sleeping baby. We know it looks complicated, but it's not as bad as it looks. Congratulations, you're going to be a great mom.